Good morning. Good morning. Good evening also for all US. Namaskar. Namaskar. Very happy to not only seeing you, but seeing your excitement to start the session. Not started yet.
તમે જોઈ શકો છો ને?
Yes.
બસ એટલે આ રીતે રાખું છું રેડી. ઓકે.
Even in the some part of the world, it's late night, but still many of you made it happen. Yes. And somewhere it's too early in the morning. That's really the sign of your strong intention to learn and to help more and more people and to spread this word of like a Ayurveda, Siddhaveda, to bring this science to every heart on this planet. This way, we will be achieve this mission. We will accomplish our mission. As Smita ma'am already explained and mentioned in the messages and previously during the talk with us that today she is going to talk more about practical, clinical things. And it's all like everything will be useful for all the beginners. Even none of us are like a super expert doctor, but still how to understand the client's difficulty and how to still be helpful in the different situation. How to begin with the small like steps and to give them the small experience. In the next 45 minutes to 1 hour, we will see that. And then, of course, like always, Dr. Smita's favorite quote, like ask anything. So she is always ready to answer all the questions that we will ask. On behalf of all of us, I request and I invite Smita ma'am, please share your wisdom, techniques.
Okay. Give me a second. I don't know why I lost my... Okay, great. Thank you. Thanks for inviting me. And good morning, good evening to everybody, whoever joined from different part of the world. Namaskar. I am so happy here, and I'm so happy that I'm sharing today with you something very important. Whatever I'm going to share is not going to give you any specific technique or tips today. Today, my intention is to actually share the fundamental way of healing, and that you can use for anybody in your life, okay? So let me share the screen with you, and I am just learning this, you have to understand. So if I make any mistake, please excuse me for that. But I'm not able to share the screen. Why? Screen, right. Okay, start the broadcast. I hope it's coming, right?
Yes.
Because I can't see really.
Yeah, it's happening.
It's happening?
Yeah.
Okay.
Just getting open.
Oh, right. Okay, getting ready. So I need to now open this file. Right. Okay. Okay, great. So before we begin anything, my really my deep gratitude to our lineage, because we are using Ayurvedic philosophy, but we are using it in a very practical manner. And that has come through this knowledge of the lineage, which is transferred from our teacher to his Sishya, to his Sishya, to his Sishya. And when our teacher taught us, he said that you have to keep it alive and spread it in the world. And that's what we all are doing together. So I'm very grateful to all of you that it is going to live on this planet beyond my and Dr. Naram's life, because of all of you who are going to practice or who are already practicing. So that's my deep gratitude to all of you today. Now, I want to remind this basic principle, and I hope everybody has learned that. This is the fundamental we follow. And based on this, we have to decide what kind of a stage he is, whoever comes, whatever is the label, don't look at the label. I want to share a quick example of the first AIDS patient we saw in Italy with Dr. Sebastiano Nello. In 1990, we were invited to meet a lady. I don't want to say the name of her, but she was from the royal family and she had a palace. And we went to see her in the palace, and she suffered from AIDS, which was at that time and now also known as high stage of HIV, where life expectancy was only 6 months to 1 year, according to her doctor. And in our life, for the first time, we saw somebody even suffering from AIDS. We knew only AIDS for India, because India gets always foreign AIDS all the time. So we knew only foreign AIDS. We didn't know this AIDS. And me and Pankaj, we both are checking the pulse, and in the pulse we find extreme low immunity, beige, high beige, severe AMA, blocking the absorption and metabolism. She was only 37 kilo, okay? And the doctors said that she will die soon and she had a severe pneumonia, lung infection. If we give antibiotics, the immune system is killed by antibiotics, so we can't give, and it was not working anyways to control her infections or diarrhea or anything. And we never treated this kind of a case in our life. What to do? And that happens with all of us. And that time, what to do? So we followed the pulse. And we followed these 6 stages of Shat Kriya Kal. So when we found beige comes in the section of number 4, fourth, localization of doshas, sthana sanshray. Beige is kapha accumulated in tissues. And according to Ayurveda, what are the tissues which are always attracting the tissues and srotas which are attracting kapha? Those are definitely polluted. So respiratory system attracts always kapha. Stomach sometimes, yes. Meda dhatu, in this case, no. But, and then we saw that her vata was going 3 level high and in between 2 level high. So that means whole respiratory system was full of mucus. Lot of stress, of course, was there because she had a fear of dying and she had family and she had a child. So, so we started treating first beige by giving Asthalok Divya Swasjivan, obviously. From the symptom you could know, but also from the pulse it was clear that her kapha is pushed into the tissues and it has polluted Rasa Dhatu as well. If you look at HIV, it is actually eating away, the creamy virus is eating away in our blood tissue, the immune tissue, rather, not blood tissue, but immune tissue. It goes inside and it's eating away. Then I started studying afterwards. Then I realized that immune was low. So high dose of D-Viro, Jivan Yog, like 6 times a day, 2 tablets, just to boost it so quickly. So low immune, we took care. Then we took care, low immune was coming in the stage, manifestation of disease, and differentiation, secondary complication, bheda. She was in the 5 and 6 stage, because if you look at HIV symptoms and AIDS symptoms, when it goes in the secondary complications, you get diarrhea, lymph nodes, infections, respiratory, all of these things. So she was in the stage of Vyakti and Bheda. So we need to then do 3R formula, which I will discuss today. But she was so weak, and still we did the detox by giving a small diet of khichdi and vegetables only 7 to 10 days every month. And I was in contact. I told them to call me every month to tell what's going on. And of course, Dr. Nello was also following them. So when it goes in this stage, which was here, where it is stage 5 and 6, you have to do detox, very important. Without that, it's not going to be controlled. And depending on the person's capacity, you have to design the detox, which we are going to talk today. You can do several kinds of detox, very important. It can be once a week, it can be 5-7 days a month, or 28 days, or full panchakarma, whatever, but you need to do the detox. That is important. So we did that detox. We worked on the immune system because there was a manifestation of disease in respiratory. Sthan Sanshray was in the respiratory. Ama was accumulated in the digestive tract. And there was secondary complication in terms of lowering the immune system. I'm explaining this because you will understand there are so many situations coming in our life today, there is no diagnosis. People have so many symptoms, or there is complicated diagnosis, but nobody knows why it is happening. And from the pulse, you can always find out these 3 points. Number 1, Vata, where Vata is moving. So you will know Sthana Sanshray. So where is the localization of this situation? Number 2, look at heat pulse, Bhej pulse, VAT pulse. These 3 pulse indicate that there is dosha or excessive ama pushed into the tissues. And based on this, you will understand which tissues. Then you will understand secondary symptoms. So if the disease has some name, but besides that name, there are other symptoms. So it is a secondary symptom. You have to do the 3 steps, definitely in that case. So now I hope this is clear. If you have any questions on this topic, which I am talking right now, then please write it down, because I am going to take a live question answer just in 10 to 15 minutes. Okay, my lecture is going to be very short today. It will be more ask me anything. Ama. This is the name of the session for me today. So from the gut, the toxins are produced. They are pushed into the blood system. And from there, they start spreading all over the body and getting accumulated in the places where they find the spots. Like in our house, always dirt and dust or fungal or anything will find spots to get accumulated. And there they start then damaging the system wherever they are getting accumulated. And then there is manifestation of the symptoms. Finally, when it becomes chronic or people are taking medication, suppressing it, then it is showing the secondary symptoms. Sometimes with the medication, main symptoms are suppressed, but the secondary is coming. So this is, you keep in your head and in your heart and in your blood, these 6 steps. Only then you will become a greatest clinician on this planet. So I will share this PPT, and I already explained everything, so I'm not going to talk now these 3 slides. You will read it again for reference. So in order to remove and reverse this process, because our focus is always, somebody asked me, what is the difference between the pulse reading taught by so many people on this planet? For example, Dr. Vasant Lad, I respect him highest. He is the Rishi of Ayurveda. But his tradition, in that the pulse is showing dosha, what is imbalance, which dosha is imbalanced, which dhatu is imbalanced, but it's not actually talking about the process behind it. While our lineage is focusing on the process behind it. Sorry, I think we lost it, right? Yeah, our lineage is showing the process behind it. And that's what is our focus, basically. So we want to reverse the process behind it. Only way to reverse is, number one, as a healer, we have two roles to play. Number one, you have to give some immediate win. Something immediate, they feel within a week or 1 month, something is better. So whatever easy to catch and easy to calm down for us should be attacked immediately, using marma point, home remedy, immediate diet or something, so that there is a faith created. And then you have to make a plan of action to reverse it and discuss with the client that, look, your illness is a very chronic one, and we need this and this and this type of plan of action for that, right? That's what we have to do. So first step to reverse the process will be to pull out the toxins wherever they are accumulated and bring it to the digestive tract, because that's the only way you can remove it. And then either you can do a serious panchakarma process, or you can do daily elimination depending on which kind of toxins. For example, vata and kapha toxins are removed by castor oil, vaka oil, particularly vaka oil type of laxative to be given every night, daily basis. So one is that you can pull it out every day and expel. Pitta type, you need virechan or easy detox type of things to remove them. So eliminating toxins. Second, do something to bring back the body to the natural state, because the tissues are impacted. There are scars from these toxins which are deposited. Even if you pull out the toxins, you need to do something to recover those tissues. Make a list of things, tissues you need to recover and how you are going to do it. And then lastly, you have to nourish and bring some kind of a renew or rebuilding process so that there is a permanent, long-lasting relief. So we will talk about that. So remove type of toxins which we need to remove are always excess vata, pitta or kapha or ama. That's it. Very clear. And sometimes chemical toxins from taking substances, excessive exposure to chemicals, environmental chemicals, that I didn't put it, but yes, that's another one. And so these are different toxins that we have. And emotional imbalance also creates emotional toxins converted into physical toxins, which are always in the form of excessive vata or sometimes excessive pitta. If there is old anger, it converts into excessive pitta and causing pitta related issues like skin problem or headaches or acid reflux or lot of such things. You know what are pitta related. I don't want to go into that. So again, emotional and chemical toxins are also part of it, but they finally are converted into this only, because chemical toxins, depending on which chemical. For example, if somebody is exposed a lot to marijuana, it is a kapha pitta increasing type of substance. So you have to work on kapha pitta. So it depends on which kind of toxins somebody is exposed, but finally it is converted into this only. That's why I wrote it down only this 4. Next one, different kinds of detox. So monthly detox, which is 7 days on moong and vegetable diet. Now here you have to be careful. If you have to eliminate kapha type of toxins, for example, then less moong, more vegetables. If you have to eliminate pitta type of toxins, then both combine equal. Even moong can be more, it's okay. But if you want to eliminate vata type of toxins, then moong and vegetable with lots of ghee in that. So it will still detoxify, but it will not increase vata. Remember this very much. So how you can design a toxin depends on which kind of a toxins need to be removed. Same with the healthy meal detox. For example, ama, only moong soup and ginger tea will be very good. So this is how we can actually design which kind of toxins are to be removed and what kind of a diet, little tweaking in the proportion of vegetables and moong will create an adaptation to their need. This is a healthy meal detox. Everybody knows this is 28 days program thanks to Dr. Rehman and our team who actually designed it based on Siddha Veda principle during lockdown to help people to detoxify, because we believe that detox is one of the key to vibrant health. First step, cleaning your house, clean your house, that's it. So this fatty toxins, this healthy meal detox is so great because it also works on a modern principles where we have also found it now based on pulse that fatty toxins are actually accumulating in liver and can be expelled to the liver, while watery toxins from the kidney and undigested food toxins from the colon. So that's how it can be done. So this is designed, and again, this can be tweaked. You can check with your mentors or somebody from our team. There are 12 mentors actually now worldwide, so you can check with them how to tweak it, how to set it good for Vata, Pitta, Kapha or Ama. This can be slightly adapted accordingly. And it is a home base, so very easy to do. But the most important one is this one, clinic based, which we do it in India. And my vision is to actually create clinic just like India, where people from their home come to do the home-based detox, like Joy is doing now already in Australia. I appreciate her so much for that because it needs a lot of courage to run this kind of a clinic. But trust me, people cannot travel or stay in some place because it's very expensive. For example, if I had to, clinic-based detox would cost $1,000 or $1,500 in the Western countries, maybe 2,000. But if they travel, they stay somewhere, it will be more than $5,000 to $7,000. So it is very expensive. But if you have a clinic base where people from their home come and go, take rest, take off from their work and do it, it can have the same result. And it will have 3 to 4 times more results than healthy meal detox, because this panchakarma, what we do, yesterday there was a patient who came from London, very old client of us, Indira Ben. And she's a pharmacist actually, but now retired. And she asked me, why is your panchakarma so deep and so effective? We find instantly that our body has removed all the toxins. We went to Kerala because it was so relaxing. We went to also Gujarat in some place because it was in some nice area. But we didn't see the same result. Why? The reason is that we actually focus through every process in this panchakarma to move, first to move. Even the massages are different than Kerala because we do the massage which moves, liquefies and moves toxins from deep channels to the digestive tract and expel it. That is the way we do it. While other places, no, they don't focus on that. We make sure that we don't do the main karma like purgation or Vaman, etc. Unless in the pulse we see that there is a accumulation of this dosha in the digestive tract. They are moved from the tissues through the digestive tract. So whatever, most people who are in the 5th and 6th stage, they will benefit remarkably. They must do this kind of a treatment and the result of removing toxins and moving it out from its own sthana, its own location where it is lying there for years and years and years, will create the result 6 to 8 months earlier than expected. So that is why this is one of the best. I am completely advocating it all the time. And I did my own Panchakarma in November. It was led by our team, Dr. Neetu Patel and Dr. Dutt. Both of them together were there at that time in Malad Clinic. So I took their help. And it was very successful Panchakarma. And people since then are always asking me, suddenly, why am I looking 4 or 5 years younger than 4-6 months ago? That's the first effect that you can have. I did it just to remove my pre-diabetic, but I do it as an anti-aging process for more than almost 30 years now. I've done it for 15 times. Like you maintain your house, this is what I do. And that's the main secret of my, longevity and feeling good all the time. So now we go into the restore. So when the illness is only until the 4th stage, which means there are only symptoms created for a few years now, but the tissues are not damaged. Example, arthritis. In the X-ray, there is no degeneration, there is just inflammation. Then it is in the 4th stage, but in the X-ray, if there is degeneration, the bones are degenerated, grade 2, grade 3, grade 4 arthritis in the spine or in the knees, hip, then you have to do Panchakarma for sure. So, but until grade stage 4 of Kshatriyakar, where there is just the symptoms created, inflammations there, blockages there, but no degeneration, you can just take care of that person only by doing restore process. And the tool to restore the health are lifestyle, changes in the lifestyle, a simple change. For example, osteoarthritis and osteoporosis, you advise them to take half an hour nap in the afternoon, will bring up kapha. Obesity, PCOS, exercise will help. Pranayam will help. So these are lifestyle changes. Diet is fundamental. Based on what is imbalance, you can design the diet. I'll come to that actually. Home remedies, herbal formulas, and marmas. The treatment fundamentals here are 4. Remember 4 treatment fundamentals when you are doing restoring. First is always and always focus on Agni balancing, Ama reducing. Even if it is a problem like Pitta, skin disease, make sure that you are still working on Agni balancing using Manda Ushna, which means cumin, coriander, cinnamon, turmeric, that kind of a herb tea you are giving so that Agni is increased, but there is no increase in Pitta. But Agni has to be increased because starting point of any illness is production in the gut, and that process is still going on. We have to stop that. So Agni, and depending on home remedy you can give if there is a strong imbalance of Agni, of course, Amrutras, which is creating all the doshas balanced and Agni increased. Amrutas is the safest thing to give in this case. But if you look at Ayurvedic formulas, each one has Agni increasing 1 or 2 substance. So if it is a mild problem, don't add Agni increasing extra formula because it will be heavy on people's pocket. You remember, then manage it through the home remedy. So I am talking about how to make a plan so that it is really effective, how you can not give a laundry list of products, but still take care of these 4 aspects and prioritize. So if the Agni is not extremely low, then just give a herbal tea like cumin, coriander. If it is Kapha Vata imbalance, then ginger, ajwain you can add in the herbal tea. You can create your own herbal tea formula based on this actually from the kitchen. for a little Agni imbalance. But if there is a huge Agni imbalance, then you need to give Amrutras, sometimes even Anulom, if Agni is imbalanced at a tissue level. But Beta Boost is also working for that. So you can choose, but depending on severity, okay? Remember, we want to be focused on creating the plan for herbal formulas and manage most of the small things using only her home remedies, diet, lifestyle, Marma points, etc., etc. So make sure you make a priority on the main point when you give a herbal formula. Balancing dosha prakop. So you have to think which one is imbalanced, okay? Specifically, which one is settled in the tissues, looking at Bhej, VAT, or heat in the pulse. Heat can be minor, can be major. If it's minor, it's just starting to effect. But mostly it is in the gut right now. Okay, so that's what you can actually analyze. If this VAT is not there, if Bhej pulse is not there, if heat is not there, then it means that it is still in the gut. It's not moved too much far. Okay, and it will be easy to remove. Always anti-inflammatory blockage removing. So anti-inflammatory you can do either for a mild and anti-inflammatory cases, diet, fermented, sour, gluten, dairy, red meat are all inflammation causing. Stop them immediately. Fried food, all of these are also blockage creating. So just by stopping them, you can actually remove inflammation. And then small detox. If somebody doesn't have a great strength, you can even put them 2 days every week on a mung and vegetable diet. Or you can do 7 days continuously every month, mung and vegetable. I prefer 7 days continuously because every day there is a deeper level of toxins are burned. If you do just 2 days, the effect is not that good. So 7 days every month, even that simple thing can help, you know. Ginger water, cumin, coriander, fennel water, all these different things you can plan. And then finally nourishing the damaged tissues. So for example, taking arthritis, Sandhi Yoga, if you look at the formula, is Agni balancing, anti-inflammatory, and Dosha Prakop balancing. It is in these 3 categories. If you look at the Pain Mukti MJ, anti-inflammatory, blockage removing, nourishing damaged tissues. If you look at Sandhikal, mostly nourishing the damaged tissues and Agni balancing at bone, Asti Agni stimulating. If you look at the herbal formulas there, Ayurvedic reference for mustaq, which is one of the ingredients in Sandhikal, is for creating Asti, stimulating Asti Agni. So this is, you should know how the herbs are working and then give Amrutras only if it is necessary, okay? Not otherwise don't give, just these 3. And if it is severe pain, Mahavat Nashak, for instant relief of pain in the beginning, because you want to give some small win. They should feel some instant relief. So that is how you can plan. I'm just giving examples so you can understand what it is. And I'm going to actually keep this in, please write it down. We will actually do a live Q&A and we will now talk about different illness and I'll ask you what is your point of view. Renew is nourishing. This is, I'm not doing that smoothie for nourishing, but one example is Matra Basti and tissue rejuvenation. This lady is very, Jane is our client actually for last 20 years. At 74, she came to India, did Panchakarma and controlled 2 Panchakarma she did and controlled arthritis, reversed it completely, blood pressure was gone. And now she's following Matra Basti once a week for 20 years and takes the herbs. You will not believe me, at this age, she has no Alzheimer, no arthritis, no blood pressure. I'm like so impressed by her health and how she has followed everything that we recommend. So I just took that. Now we go for question answer and I'm going to stop this presentation And I'm going to stop sharing the screen. Can you? Okay. Okay, so we stop. So let's start now, question answer.
Thank you, madam.
Yeah, let's start the question answer now. And if needed, I can start this whiteboard. I don't know if it is there. Oh yeah, there is whiteboard, right? Okay. So, Dr. Hemang,
Yes.
whoever has a question can raise their hands, and you can actually let them unmute or something and just ask the question. Let's do it like that.
Yeah.
Can you see the whiteboard?
Yeah. Yes, ma'am.
Yeah. So on this whiteboard, everybody can write. So I just want to take example of which example? PCOS. Okay. Let's take example of PCOS. Okay. Okay. It's not working. Okay. PCOS.
First to click on the text button. T.
That's what I did, but it's not even clicking there. It's not staying there.
Okay. PCOD.
But you can type it then. PCOD. You can type. So let's take example. Any questions anybody has?
Yes.
Hema?
Yes.
Yeah. Let's
Lisa.
take the questions. Yeah.
Lisa, please.
Hi, so nice
Hi.
to
Yeah.
so nice to hear you
So
again
nice
and
to
see you again.
So nice to see you.
Yeah, so just two quick things I want to mention.
Okay.
So our family, we adopted two children with special needs at the start of COVID. And we've been working diligently with them using the herbs and Marma points for the last 2 years, I guess.
Wow.
Our one daughter is 7 now, and we keep getting a lot of pressure to put her on meds for ADHD. Both kids have been diagnosed with ADHD, PTSD, developmental delays, possibly FASD. And but our daughter's highly impulsive and has a lot of challenges controlling her emotions, is very volatile with her emotions and her behavior. So struggles quite a bit with that organization and focus. And we have her on Mind Power, Brain 2. Oh, what's the other? I'm working with Dr. Ashwini.
Dr. Ashwini, yeah.
Yeah, so
probably
got her on a couple things, and you know, it's made a little bit of a difference, but I want to know if there's something that can take it to the next level to help her self-regulate.
And they were born premature, or it was normal delivery, everything?
Normal delivery for both. See, for her, I think it's the emotional part of the brain that was damaged, whereas my son, it was the neocortex and the learning aspect of his brain that was damaged. So he has difficulty with language and learning, and her, she has difficulty with behavior.
And you have checked their pulse?
I am just learning how to do that and practicing and trying to figure it out.
These basic things, you know, you will learn in this when people come to India this time, because you all are in the, you finished almost 2 years now. So you have clarity on a lot of basic concepts. So you will be
one quick question about the pulse.
The next level of the pulse at this time, because a lot of practical training, but you know, there are these basic pulse connected with those 6 stages of the illness. And
Yeah.
that's what you need to learn. So I believe they might be having an autoimmune pulse. And if there is no immuno, you should add it as well in the plan.
Okay.
With my experience with ADHD, what I've seen is, and Niramay, these two, because again, going back to those 4 points that we were talking about, and I want that you check the pulse, and you check the pulse and have Dr. Ashwini on the video call so you can ask her. But if you are coming to India, then you will learn it better practically, because you will have a, my teacher always said, especially Dr. Pankaj, who was my teacher in the pulse reading, he always said that every 100 pulse you check, you will master 1 stage of this Shat Kriya Kal. Okay. So you will master Vata, Pitta, Kapha if dosha is increased. Then you will master Ama after next 100. Then you will master where Vata is moving, which will tell you what is the Sthana Sanshray, which means where the doshas are accumulated. And then you will master also which tissues are damaged next 100 pulse. So checking 500 to 600 pulse will make you 60 to 80% closer to our doctors.
Excellent.
Okay. And there are only 2 ways to do that. Either you call the doctors and get a lot of clients, and we will help you to get clients as well. Now, Ayush Shakti also can help you because we have a very good marketing team. So we can help you as well. If anybody needs that help, they can always inform Dr. Hemang about it. So he will then organize it. But we want to support that you all can learn. That is the main intention. We don't want to create a knowledge in the head. But coming to India will create, at least this time, I am hoping you all will have 100 to 200 pulse experience. Definitely. You know, so that will create a basic knowledge, but you check your pulse of your both the children, and there should be Vata moving up in the head. There should be autoimmune. There will be Vata, very thin thread-like pulse. Okay. There are 2 kinds of ADHD situation. One, where there is inflammation. Okay. From the symptom that you are describing, it looks like there is a degeneration, like damage in the developmental process. So it will be a thin thread-like pulse. Okay, in that case, you need to give Niramay.
Say that again. How do you spell that?
Niramay, Niramaya.
Okay.
Niramay.
So immuno and nirame. Okay.
Yeah, these 2 should be added. So you check the pulse. If it is very thick, swollen, or very thin thread. If it is a very thin thread, there is a damage. But from the symptoms, it looks like they have Vata created and accumulated in the brain, and it has damaged the brain and nervous system. It's not just inflammation. You will need Namay for that reason. Then and give a lot of ghee, 5-7 teaspoons of ghee. Specifically, when you give ghee in the morning on empty stomach, if they take it with some almond milk and ghee or some warm liquid and ghee, will be fantastic, because it is working like an internal oleation, and every day done internal oleation will slowly and steadily nourish and renew this. So 3 steps we have to do in your child. Very good example you have taken. And I will tell you how you can do these 3 steps. Now what you are doing is only restore. Restore by doing the herb, by diet, etc. We have to do all the 3 steps. But even for the children, you can do it. So at night, because this is Vata problem, Vaka oil capsule, Vata detox capsule, minimum 1 to 2 at night. So gradually, because I've treated this kind of a case, many of them, and if you want to give a quick result just like allopathic, then you have to use all the 3 tools at once, even for the children. So Vata detox at night, morning on empty stomach, 1 to 2 teaspoonful. So if their body weight is 30 kilo, for example.
Yeah, that's about right.
Yeah. Then you can give up to 2 teaspoon in the morning.
Of the ghee.
Of ghee. And Medhya Growth is the best because that will nourish the brain tissue as well. It is cooked with the herbs, but if you can even do it with the normal growth in the morning, okay? And during the day, in every food, you add 5 to 7 teaspoonful of the ghee.
In their food, okay.
In the food, because we have to, this looks like a damaged, degenerated. It is a stage 4, 5 and 6 already. So we have to bombard with ghee, oil, and do very mild detox every day.
Okay,
very
I can do
important.
that. I've got
Mild
all those
detox,
things.
which is the Vata detox capsule. Okay.
They
They can take capsules. If they can't take capsules, give them the oil. Yeah, because oil is very awful tasting. I personally cannot take this oil. So,
well, they took Metagroot for about 6 months.
I puke very badly. Yeah, you
took
give them
Metagroot for 6 months.
Capsule, and also put always pichu. You know, every day on the head you put oil and Groot pichu. So Medhya Groot and Balada oil. Okay, Medhya Groot, Balada oil. So
what's the second oil? How do you spell that? Valada?
Dr. Hemang, can you write down everything in the text, or maybe you can start the blackboard and write it down? I remove you can put it on the blackboard. Maybe.
I'm writing on the whiteboard. And
whiteboard, yeah. Please write on the whiteboard, and the whiteboard is something that you can share with everybody in the chat. So everybody can download this whiteboard on their Zoom and finally keep it filed. So I request Dr. Hemang to help me with this, because otherwise you get confused and other people don't get chance to ask me question. So quickly, okay, because this is children, so we cannot do strong panchakarma, but we can do mild detox every day. We can do a nourishing treatment on the head every day by putting the pichu, the oil pichu on the head. Okay. So I did it. I want to give you example of this severely ADHD child. I cannot imagine. It is there on the Ayush Shakti's page. There was a live done with that child who sang a song for me. But she didn't sit in one place. She was only going round in the whole room constantly. Her eyes completely restless, could not speak a single word because she was also autistic. Both combined together. She was autistic spectrum, ADHD, etc. It is now 8 months I am treating, and I've given this treatment, and the mom is so good. She's doing this pack on the head. She's doing already with Balda Jivnia every day. We call it Shiro Pichu. This is for nourishing the brain tissue and the nervous system. Then I also gave this 5 to 7 teaspoons of ghee to put in the food, 2 teaspoonful of Medhya Growth in the morning. I gave also Niramay because there was a degeneration pulse. And I gave Immuno because it was an autoimmune situation. And we checked it. She had a fever at some age, and then very young age, like 6 or 8 months of age. And then she was given a severe antibiotics. And I think that fever, viral infection attack the brain tissue, and that's how the first inflammation and then degeneration created. So I gave also immuno and rest of the things, mind power 2-2. I explained to them that you have to give high dose to get a good result. So 2-2 mind power, bliss 2-2, and brain toe 1-1, meta boost. You will not believe me. Her mother actually has a goal that she becomes a tennis champion athlete in world champion in her category, which is ADHD, autistic disabled category. She was not able to even hold the racket, the tennis racket, for 5 minutes in one place. She could not look at the tennis ball and hit it, in spite of trying 20 times. And now she's hitting the tennis racket so well, and in her category, she already won in a whole Maharashtra in 8 months. That kind of a concentration she got, and she's sitting in one place for 15 minutes in 8 months. So you try this. It is a big path. I normally don't recommend any allopathic because anyways it doesn't work. But even if you give because of family's pressure, you can stop in 6 to 12 months, slowly, gradually, by tapering it down, because this plan will take 6 to 8 months. It will not, and even allopathic doesn't make them normal. Okay, I've seen it. That's why I'm telling you. So any other question?
Yes,
Otherwise,
I had a second question.
Yeah.
Our other daughter,
Yeah.
I have concerns with her being on the verge of having an eating disorder. She is extremely picky and becoming more and more so. If I let her have her way, all she would eat would be bread and cereal. And she's getting to the point where she's being sneaky and she doesn't want to eat different foods and meals that we prepare. On occasion, she'll eat mung bean soup.
Yes.
But when she's in the right mindset. And I think it's becoming a more fixed mindset with her. And it's hard to gauge how much do you encourage her. Okay, come on, sit down and, finish your meal. Or do you?
And she's
ease
also
off?
ADHD and
No.
autism.
No. She's always been super healthy. She's rarely sick.
Okay.
But over the years, she's becoming more and more and more picky and more fixed in her mindset. So she's 12.
Okay.
She has her cycle, which is not regular. And that's a concern because it comes every 3 weeks. So Dr. Sweeney, we have her on brain 2 and on something to regulate her hormones, and I can't remember the name of it right now. So
right, you can just give her meta boost, but again, you probably need to check the pulse, and if her vata is going up beyond the kapha finger, that means she has vata going up as well. In this case, it looks like, so you can add ghee in her food actually, if it's possible. Slowly.
I do. I sneak it in there.
Yeah, that would be great
today.
But adding meta boost will slowly reduce this situation. I've seen it because it looks like, again, in this stage 6, go back to the basics, 6 stages. This looks like up to the stage 3 and 4, okay, where vata has been created in the gut, it's been pushed into the nervous system, and that's why she has this picky based on her mood, but it's not severe, so it's not degenerated or something. So you can just manage using a small things, like ghee For example, you can put a ghee on the belly button. That's another thing which can help because it will bring vata down immediately. And every day you have to do it, of course. Meta boost, because meta boost is something that is restoring very quickly the vata imbalance in the nervous system, in the nervous system. In Ayurveda, there is a concept of prajnaparat, where a person's nerves are damaged or brain is damaged. The manavaha strotas, the mental channels are polluted by vata or ama. Because of that, or kapha, because of that, that person knows that this is good for me, but he doesn't want to do that.
Exactly.
Okay? In the heart knows that this is good for me, but doesn't do that. This is situation of prajnaparat. And meta boost is actually a specific formula for that kind of a situation. So you should give just meta boost as well, I would say.
1 and 1 or 2 and 2?
If her body weight is 50 kilos, then 2, 2. Otherwise, if it's under 40, 1, 1.
Okay, thanks.
Yeah. Okay, great. Any other question?
No, thank you. That was wonderful. So appreciate your help.
Yeah, we need to, as a healer, we always go back to basic. Which stage the problem is and what do I need to do? If it is stage 3, 4, restore is enough. But stage 5, 6, you have to do all the 3 process. Dr. Hema, next question you want to take?
Yes. Yes. Thank you. Thank you. Deborah.
You want to keep this whiteboard or remove it? What do you want to do?
I think, yeah, not required. Ma'am.
Not required? Okay, so we remove it.
And I am writing everything in the chat box, Lisa. Maybe you
Good.
can copy paste from there.
Right.
Yeah, thank you. I see that.
Yeah.
Yes.
Okay, Deborah, please.
All right. Hi,
Hi,
thank you so
Deborah.
much. I really
Hi,
appreciate it. Such an informative session. Anyway, I'm so excited to go listen to it again because you gave so much information. My question is, I'm trying to understand this concept of detox in Siddha Veda compared to my previous examples of detox. I did understand that great example that Lisa had of her daughter, that because it was a vata cause, you used the vata detox with the oil, actually the vaka oil, right?
Yeah. Yeah.
And so a lot in our class, they always say, okay, we gave these herbs and we did a detox, and then, but they never say what the detox was. And so like when somebody's elderly, like with my mother, they just gave her 3 Varation and 3 Amrutati for 3 months, just gentle detox, right? With the child, you said just do the vaka oil. And then sometimes when we have people here in the United States and we're on these chats and people are going through the healthy me and they're saying, I'm having these really severe reactions and these symptoms, and the video will say, well, just keep pushing through it, where I would think, well, you'd want to back down on some herbs, or, or somebody's not having an elimination on Varation Day. And I'm thinking, well, wouldn't you just ask them to take, like they haven't gone for 6 hours, well, go ahead and take something else. So these type of decisions of understanding how you make decisions on when you're helping people go through a detoxification or a cleanse, since it's so important in the treatment.
Right. This is actually more of what we call how to handle detox type of question, which you probably should also ask your mentors. But I would just give you an overall view, okay? Overall view of detox, because I just want to give you my own example. I always share this personally. My family, I'm coming from a family of 4 generation Vaidyas, Ayurvedic doctors, okay? My uncle was Ayurvedic doctor, very, very popular. He had like 100, 200 patients every day. He was in the village and he was full of that. Then his father, my grandfather was Vaidya, and his father was Vaidya, and his father was Vaidya, okay? So I received notes from them and their style of practice. They didn't do the pulse reading. This essentially I learned from Pankaj and our lineage. But they were very focused on Panchakarma. He did hardcore Panchakarma, okay? So we lived in Mumbai and my uncle was in the village. And when I was 10 years of age, at that time, I had a severe pain. I was rolling on the floor. I still remember, I thought I'm going to die. And my doctor, my father took me to the general physician. That was in 1972 because I was born in 62. So 72 it was. And my father took me to the general physician, and that time no sonography. They didn't know what to do. They thought this kind of pain means definitely appendicitis, it will burst and you will die, so you have to cut it and you have to remove it. Finished. So he said, if the pain is not going away in next 24 hours, we will do the surgery. My father comes home and I still remember him talking over phone. At that time, it was so difficult to even, I think the call started. I don't remember if there was a call, but how he communicated, I still don't remember. But somehow they spoke or something happened, and then he gave me a basti, enema, with castor oil, only when I was 10 years of age, or maybe 12 years, I think, 74 it was. Enema he gave, bastis, he gave enema with castor oil, ginger, cumin, coriander, all these things from the house and everything. And I did the enema, and just in half an hour I passed the stool, lot of gas, and my pain was gone. Okay. So it depends. You have to take a decision based on the symptoms and the pulse, both. So if, like children, you or very elderly people, when you don't want to give a strong detox like healthy meat, then daily removing toxins using Amrutadi, easy detox, Vaka oil is okay. And especially old people, they are always Vata. So just giving this something to lubricate will help, okay? But skin problem, headache, migraine, you need to give something like Virechan, which is Pitta reducing, easy detox, Amrutadi, which is Pitta reducing. So always remember on a daily detox what to do based on what is predominant in that person. And what is predominant, you can either find it by asking questions on the symptoms. If it is more Vata symptoms, common Vata symptoms are always pain, stiffness. On the video call, you can also look on the face when the Vata face is always like more long and not V-shaped. This, so you can understand. I've done a face reading session. You can even listen to that, how to do the face reading. But you can understand also from the symptom which are the most predominant symptoms. And if you look at the pulse reading format questionnaire Dr. Hemang has shared with everybody, there are predominant symptoms of Vata, Pitta, Kapha. Even that can guide you by asking questions. You can understand. So first is that the daily detox, to do some cleansing on a daily basis or once a week, giving high dose of detox and do one-time cleansing every week. Okay? Like Vaka capsule, normal dose Vata detox is say 2 capsules. So give 6 once a week, 5-7 Virechan once a week, easy detox or Amrutadi 8 tablets. So there is a loose stool once a week and removes all the toxins. That's also one way of doing in a soft manner. But some people have a very deep-seated toxins, and their symptoms are in the stage 5 and 6, even 4, 5, and 6. So there are symptoms already created. Maybe they are not very chronic. They are able to manage it doing exercises or some diet, but moment they stop the diet, the symptoms are coming back. Or they are able to manage using some kind of allopathic medication, but suppress it, and they want to get rid of this medication. So that stage, you have to do healthy meat detox. It is very important. And when the toxins, any kind, vata toxins deposited in the tissue will create dryness and roughness in the tissue. Okay. Just like, there is a smooth surface, and when it gets dried because of too much air or your hair getting dried, it looks rough. So inside of our system gets rough. That detox is difficult to remove. You need a lot of oil in the healthy meat detox. And in that kind of symptom, it is important to give morning ghee, at night high dose of Vata detox capsules before actually the Virechan day comes. So that is one. The second is Pitta accumulated in the tissues and dried up, Kapha or Ama mucus accumulated and dried up, because they are accumulated for years and years and they are dried up for years and years. So lubrication is important. Enough lubrication when you do, then they will be melted and they will be pushed out. Okay. So healthy meat detox is a very home-based detox. Sometimes you cannot push out the toxins just by healthy meat detox, and it is possible that the day of Virechan, the toxins are not removed easily. So detox process is something you need a guide at that time. You cannot run it by yourself. It is not possible. You need a guide. If you want to handle it yourself, you need a guide on your own client. If you have a client who is under detox, do it on that client with your mentor.
Okay.
I'm just giving you general guideline, but it needs a very, very practical experience. It's like a mini surgery, I would say. It's like a mini surgery, because we are actually removing some toxins which are there for years and years. But I'm just giving you a general guideline, general guideline. Yeah.
Yes, thank you very much.
Yeah, take care.
Good.
Any other question?
Yes.
How long you want to
Deborah.
do this session? If you want, I will do Ask Me Anything session again one day. Whenever you want, I offer that. This is more interesting.
Thank you.
But we will just remind this Sat Shri Akal one thing, because every time we have to look at the basic. We have to go back to basic. That's it.
Thank you. Thank you. Andrea.
Thank you. Namaskar,
Hi.
everyone. Hi, Dr. Smita. Thank you for making yourself available to us. This is awesome. My question is
We
concerning.
will have a Ask Me Anything question also in India, huh, Dr. Hema?
Yes.
Oh, wow.
Ask Me
Thank you.
Anything question will be in India as
Thank
well.
you.
And our mentors and myself will be there. And we'll have 2 hours session extra for that.
Oh,
Please
this is,
Thank
come.
you.
yes, this is exciting. So my question is concerning the autistic child you spoke about earlier. I watched that video. I must have replayed it about 10 times.
Yeah.
There's a pressure point that you press by the shoulder and under by the neck.
Yeah.
Where
Good.
exactly
Good
is
observation.
that? And I
Yeah.
just couldn't pinpoint exactly where you were pressing. Would you
So
mind
it is
sharing with us?
actually, the clavicle bone here, clavicle,
Yes.
the collarbone here. Okay. So that point is inside the collarbone. And if you draw a straight line from the jaw, straight line.
Wait, you have to adjust your camera so we can see. We can't see your neck, your
Okay.
clavicle.
Okay.
Yeah. Okay.
Yeah. So from the jaw, you draw a straight line, and then inside the clavicle, wherever the line ends inside the clavicle, if you press, you will find a very tender point. Okay. You can adjust your finger a little bit here and there to find a tender point, because if you press somewhere else, you will not find a tender point. There will be a lump, a little lump, because and you press it, it will be a little tender. That's the point that I'm pressing.
Ah, beautiful. Thank you so much.
I forgot the name of this point, but Dr. Naram also uses this point a lot when he did Marma, Pichoti, and many things. This is basically opening the emotional channels and emotional blocks, basically.
Does it matter which side, left or right?
Normally, right side is better because we want to create the future. But if you want to work with the past, for example, past trauma, then I recommend always left side.
Okay, and you also mentioned something about stroking under the neck, by the mouth, the throat there area. Am I correct about that? Like,
What was it I spoke about?
I think you mentioned sort of rubbing from under the throat.
Oh, yes,
forward.
that's for the speech. It's a speech marma. So actually, I cannot do it on myself, but these two, you know, sides of the throat. So with the fingers, you have to just like a comb, you are just doing like this. Can you see it?
Yes, perfect.
Yeah, like a
Thank-
comb. You can ask your mentors. This is known as speech marma.
Wow, thank you. Finally, I got my
Yeah.
answers. Thank you so much.
Great, lovely. Any other question? We'll finish in 10 minutes. Is it okay, Dr. Hema?
Hilke?
Huh?
Good
Ilke.
morning.
Good
Dr.
morning.
Smita. Very happy to
I
see
read
you.
your book. Wonderful book. Thank you.
Thank you.
It is so beautifully done. I am impressed. Thank you. I would recommend actually to keep it on Ayushakti's website. We would like to also offer it to the people. Huh? Dr. Hemang, please do it.
Yeah.
Yeah.
Thanks a lot, Dr. Smita.
Yeah.
My question, I have still difficulties when I have a client taking the pulse, and I know there must be some kapha somewhere because of the symptoms. But in the pulse, I'm not able to feel the kapha pulse, and I don't recognize any beige. So what's the mistake?
I think you have Dr. Hemang always coming to your place, right?
Yeah.
Yes, hopefully soon again.
Yes. Yeah, maybe sometimes you can also come to India when I am practicing. So you have at a time 50 pulse in one day, 50, 70. So you become sharper. But I believe that there is a possibly problem of not positioning the fingers right and not putting the right pressure. Okay.
Okay.
And that is one. And the second thing regarding beige, if your own fingers, okay, for example, are too cold, you will not find the beige. So especially I have seen it in Europe when I'm working. If my hands are cold, I cannot feel the beige.
Okay.
Your hands have to be in a normal temperature. So you probably need to wear a good warm under what you call something, so that your hands have a good circulation and they are not getting cold. They are warm. They're warm and room temperature, so that you will be able to then feel. If your fingers are cold, you can't feel their fingers and the coldness in them.
Okay. Thanks a lot. That helps.
Good. Thank you, Nalini.
Good question, huh, LK? I love what you are doing. I'm very proud of you.
Hello, Dr. Smita. Thank you a lot for this wonderful
hello.
session. Thank
Hello.
you, thank you, thank you. I have a question. I have a case of a client that will go and see Action America during 10 days to help him with detox. And I know it's guided that I go and I help, but I don't really know how to do it. And we had already a session with Dr. Priyanka, and the thing, what he has cancer in the prostate, sacroiliac pain, like the doctor said he had a herpes and that the nerve was attacked. And the thing is, he is so in excruciating pain. He actually wants the healing, but he doesn't want more pain. And he's very reluctant, like almost a little bit on the edge of aggressive, to say like that he doesn't want any pain anymore. And he's on a lot of medication to sedate him. And I really want to help him, and I can feel that it's guided, but I don't know how to. My specific question for him is how to do a detox with herbs when someone doesn't want more pain, and how to handle that, because the allopathic medicine, as you said, won't make him healthier, but the herbs and the detox would. So how would you go about with?
Yeah, well, basically, see, for the detox, you might need a guide because detox is like a mini surgery. And I think you need your mentor by your side when somebody is doing detox. It's very important, okay? So, so that's one. And the second thing is multiple situation. You haven't obviously checked his pulse, right?
Oh, I did 6 months ago, and he had a cancer pulse. That's the only thing I could clearly see. But yeah.
But herpes is always immune attack on the nervous system. So you have to give Pain Mukti MJ, because that has 2 ingredients which removes the immune inflammation in nerve, muscles, bones, etc. Okay, so Pain Mukti MJ is very important. You can give even 4 times a day, it is all right. And D-Viro and Immuno, very important, and give high dose, very high dose. For the detox, I think you need probably a mentor, because he appears to be having Pitta and Kapha predominant type of cancer. So might need more focused on Kapha Pitta type of diet. So healthy meat detox is good enough actually, because it is focused on that. So it is fine. You can do, but you might need help there. Yeah.
And thank you a lot. Can I ask you regarding the pain, because all these detox will augment the pain, right? There's no way around this.
It will not increase pain. No.
No, it's possible to go through the detox without having these.
No. Because detox reduces inflammation. His pain is coming from nerve inflammation. So I think it will not increase, it will reduce it.
Okay. And I guess a lot of ghee as well. Okay.
Yeah.
Thank you. Wonderful. Thank you.
Love meeting you. Yeah.
Good. Thank you.
You can take one
Sarmini.
more question.
Yes, Sarmini.
Good morning, Dr. Smita.
Hello,
Nice to see
good
you
morning.
again.
Nice to see you.
Okay, as soon as I came back from my detox, my husband, who suffers from diabetes and blood pressure, which is on Western medication, he had a right knee pain. So I took the pulse that time. His Vata was very sharp. It was 3 plus. His Pitta was maybe 2 plus, and his Kapha I could. But today when I took it, he has developed swelling on his legs a few days ago, because for his knee pain, last few days, I've been doing the knee dara. I bought the oils and was doing the knee dara for him so that his knees will get better. It has helped because his pain is less. But I now find he's got swelling on his feet. And his Kapha is I could feel a Kapha, which is like maybe like 2 or 3, I'm not too sure.
Yeah, like beige, because diabetes
Yeah.
always has beige.
Yeah. So, okay, so I put him on CCFT. So what else? I'm also putting him on Pain Mukti, MJ, Pain Mukti, Sandical. I've got Daiba, so I put him on Daiba as well. And
So back to basic, what according to you is his stage of his health situation? Stage 4, 5, or 6? From that Kshatriya Kal model that we discussed.
stage 4,
Stage 4,
swelling.
symptoms are there, swelling is there. Yeah, manifestation of symptoms, but there are no side effects, like he never had any heart arterial blockage from the diabetes or nothing, right? So stage
So
4.
far. Yeah.
Yeah, we can say stage 4, possibly a little bit stage 5, not so much, but more stage 4. So when it is in stage 4 and little bit in 5, what should we do? What is necessary from these 3 R?
Because as soon as I came back, I took off all the wheat, milk, everything, and he's now on mung bean on some days and strict diet, no wheat. So it's on millets and everything.
Good.
He's on good
But just
strict diet.
maybe healthy meat detox will help a lot, I feel.
That's the problem is I can't do the healthy meat detox because I'm traveling and he's going to travel. So I need to be present at home to give my 24 hours.
Correct. So some detox is necessary. So maybe 7 days to 10 days of smart detox.
Okay.
You can check I think the process is with Dr. Hemang can guide you, but just, it's only with the diet. So 1 day of the herbal tea, then 3 days of the thin liquid mung soup, and then vegetable soup, and then thick mung and vegetable. It's a process. So that can be a very useful thing for him to remove the inflammation. But what else can help with the inflammation? You are getting a doctor, so you have to answer now. You are becoming a healer. In your plan, anti-inflammatory herbs are missing.
Yes. Yes, there is. I can't quite remember the tablet.
U-tone or ketone?
Oh yeah, that's right. U-tone. I don't have that with me, but I've got ketone. Can I give ketone?
Yes. You have to give something for the inflammation. And Pindaswet, always Pindaswet.
Pindaswet.
When there is inflammation, don't do the oil treatment, always a dry treatment of removing inflammation.
Okay.
Externally. Yeah.
Thank you.
Yeah, very good.
Thanks.
I think we can close the session. And
one more question.
I have a suggestion, Dr. Hemang. I'm very, very happy that people are already, slightly now started swimming. We always say pulse reading is like a swimming, and swimming you cannot learn by just listening to the lectures. You have to start swimming. So people have started swimming. Why don't you keep a session with the mentors, ask me anything, and if you want anytime I am also there. Practical questions, I am always ready to answer. That's it.
Yeah, we can keep that. Yes. We will organize the once in a month special question answer session with the mentors and you. Yeah, one more question and last question from CC. Yeah.
Okay, Sisi. Hi, Sisi. Hi.
Good morning. Good morning.
today.
Namaste. Namaste. Thank you so much, Dr.
Namaste.
Thank you, Dr. Hemang. Sorry, my
Yes.
video is not coming out for whatever reason. I have a quick question, please, regarding my sister. So, she developed this knee pain about 5 years ago. So she's 63.
63.
Okay. 63, yeah. About 5 years ago, she developed this knee thing. and with excruciating pain. And there was a large degree of swelling. So she went to a doctor and they told her, oh, you must have been bitten by something. So they gave her antibiotics and what have you to manage the pain. It went away. But since then, the knee pain and the swelling comes back on and off. And every time it comes back, it literally immobilizes her. So last week when I was in South Africa, I managed to feel her pulse for the first time. And there was, there is Vata issues. And there is a lot of AMA. The diet itself could be a lot better in terms of lifestyle.
So Vata issue, a lot of AMA. And did you see that her Vata pulse is moving towards the wrist and coming back?
Yes, that's what I mean by Vata.
Was it very thin or very thick?
Sorry?
Was it very thin or very thick?
Oh,
you don't remember?
I don't remember, no.
Okay, so coming back to her stage of disease. Okay. Her stage of disease, where is it? Right now.
Stage of disease, I would say.
Third stage, fourth stage, fifth or sixth, which stage?
I would say 5.
5. Perfect.
Yeah.
Perfect. You are so right. At the same time, because you also described that there is AMA, at the same time, her gut is still producing the toxins, which has originally created this situation, right? So it's like a pipeline, you know, the toxins are created. They are feeding toxins in the form of AMA and Vata, created from wrong diet, wrong lifestyle, and poor metabolism and poor digestion, poor Agni, what we call it. And they are pushed into the joint spaces, creating inflammation, immobility, stiffness, and finally also degeneration. Maybe you can check the X-ray and you will find there is stage 1 or 2 degeneration, because that's why it is stage 5. So, so you have to stop that process too, right? By giving the diet or healthy meal detox, for example, will be a very effective thing here, because that will remove the toxins from the joints, AMA and Vata, and it will activate the Agni. So further damage is stopped. So one, we have to remove, when it is in stage 4 and 5, you have to do all the 3 stages. Number 1, remove toxins by doing healthy meal detox or 7 days of fasting, but 7 days will not be so effective as healthy meal detox, in my opinion. Then second, you have to restore it by doing the diet, Marma point. You are back now or you're still there?
I'm back now.
Okay, because Janu Marma will be very good here, Janu Marma, to give immediate relief. Are you coming to India this time?
Yes, I am.
Perfect, then you learn Janu Marma. Huh?
Janu, okay.
Janu Marma, we will teach Janu Marma. It is a Marma for knees and arthritis. You must have seen Dr. Naram doing it actually sometimes on the video as well. But we do it a lot and it is very effective. So Janu Marma, this can be done. But since you are not close to her, use other tools of restore, which I shared already in this presentation: diet, lifestyle, herbal formulas. In that, what would you do? Herbal formula, what would you do? Tell me.
Sorry, what was the...
What kind of a herbal formula? I'm talking about 3. You have to do 3 stages for her.
For example, I would use Amrupras.
Okay.
Meta Boost, maybe.
Yes.
To balance Agni, for example.
Right.
Mm.
But what is her main problem?
It's Vata, and which
In the
is
knee.
obviously causing pain. The movement of Vata in the body. It's
Yeah.
but Ama, it's her biggest problem. That's what I felt. I felt there's Ama, there's
Perfect.
Vata, which is already moving around the
So
body.
for Vata, what will you give for the joints so it doesn't come back and heals? In the restore section, we spoke about 3R formula: remove, restore, renew. So this is stage 4 and 5. So you need all the 3 things for her. First one is remove toxins by healthy meat detox if possible. Then second thing will be restore using diet. Even the 7 days monk soup will come in the restore section, and herbal formula and some home remedies, because you are not close to her. So you cannot do marma. What herbal formula you will give for restoring joints, arthritis? What will you give?
First, I think I would use Vaka oil to help her detox the body, to
Perfect.
get rid of Ama.
Perfect. Perfect.
Obviously with the right diet.
Yes.
And yeah.
So Sandhi Yoga and Pain Mukti are coming in the restore section. Okay. Sandhi Yoga is restoring Vata, Agni and inflammation. Pain Mukti MJ is removing inflammation, removing Vata. So it is restoring back the muscle and bones. And in the rebuild and renew section comes Sandhi Kel. Remember, okay. Andrea, you have mentioned Sandhi Kel in the chat, which is great. I'm happy. But we have to be clear what is working where. Okay. In these 3 steps, These 3 steps are a practical design to reverse the 6 stages of the illness, Kshatriya Kal. Okay, we want to reverse it. So there is stage 5, which means mild degeneration. So you have to give Sandhikel and Matra Basti at home, right?
Okay.
Got it? So think always in this, think like this. If you want to become a very good healer, think only in this direction.
Okay.
And plan it. So, for example, you have planned Metabush and Amrutras, but maybe if she doesn't have acid reflux, don't give Amrutras, because Metabush is going to help with the Agni anyways, right?
Okay.
So focus on the main problem, which is joints, and for inflammation, you can add uretone or ketone. Focus on that, because we want to give 4 or 5 herbal formulas, 3 to 4 if possible, and manage everything else through the diet and detox program, etc. Home remedy, etc. So give focus first on the joints. It is definitely arthritis. Definitely, there probably was infection some years ago, but it is coming back again and again, which means it is arthritis. And you saw it in the pulse as well. So 3 basic things: Sandhi Yoga, Pain Mukti, Sandhikel you have to give. Sandhikel for bone rebuilding, Pain Mukti and Sandhi Yoga for restoring Vata, Agni, inflammation, and restoring the bone and everything. Okay.
Okay.
And Meta Boost for Agni, because you found that she has Ama and Agni is poor. So Meta Boost. And inflammation is there, so ketone. But you try only with this and detox. If the inflammation is not coming, you may not need ketone. So just try. You see which one is more important. Can you stimulate, remove Ama? Maybe you can add Metaboost later on after doing healthy meat detox. If there is still symptom of Ama and low Agni add MetaBoost afterwards, because with the healthy me also, Ama is removing, Agni is stimulated. So her main focus on main thing, which is inflammation and joints, and give just 3 joints thing right now to begin with U-tone or ketone. So 4 herbal formulas and healthy meat detox, very important because stage 4 and 5.
Yeah. Yeah. And
That's it.
I also noticed that she has developed these black dots on her skin. That
Black
actually,
dots on the skin.
they're actually not dots as such, but they like a little bit of growth.
Patches.
Probably. I don't know what they're called.
Which part of the skin? Where? Legs?
Around
hands,
her face. Yes, around her face and neck. A little bit towards the chest. I
That
didn't see
looks
them.
like a melasma, which is normally commonly developed in the old age, especially dark skin old age,
Right.
you know, dark skin, Asian and African skin, they get always melasma after 40, 50 years of age. So you can just give Sudarum lotion to apply or something like this, you know,
Okay.
but, and turmeric to drink. So turmeric tea, home remedy. See, I am now teaching you how to make a plan, okay? So focus on the main thing right now. Don't give a laundry list of herbal formulas. And side things you can give external application, home remedies, diet, all these things, you know?
Okay. Thank you so much. I'm so grateful. Thank you, Dr.
Yeah,
Smita.
yeah, this is what we need to learn, how to plan. Okay.
Yeah. Okay. Wonderful. Thank
Okay,
you.
I hope this was useful session for everybody.
Thank you. Thank you. Yes, it was very helpful, and yes, a lot of practical knowledge and how to apply the information and knowledge that we are receiving.
And we will keep
all the
this
time.
Ask Me Anything session also in India, and you keep
Yes.
doing it again and again, once a month with our Path group, and whoever wants to join, for everybody, Ayush Shakti group, Path group, everybody combined together.
Yes. Yes, yes. Thank you, madam, for offering this.
Lots of love
time.
and big
Thank you.
love. I'm so happy that you all came. You asked such a big question. It shows that you people are sincere in helping humanity.
Yeah, today we had few guests. Normally, like we keep this session always like India night time, evening time, and then US is early morning. But this time, because we wanted to have like people from the Australia, New Zealand also. And I think due to some other commitment, Deepika had just few minutes before left. She was here. Geeta Ben is still there. Nikhil Rugani is there. Dr. Madhvi is there. Many people from this zone could join this session. We are happy that we could do this, and all of you are there. Nice. Thank you, and also special thank you to all. Like it's too late in US, too early in some part of Europe. Thank you for joining and making it happen. See you again on 4th of this month, just day after tomorrow. Very soon, less than 48 hours. Real soon. Thank you. Thank you.
Bye.
Bye.
Take
Bye.
care. Bye.
Bye.